The question, what are the causes of vertigo? Vertigo is a condition in which you feel off balance and dizzy, as if you or your surroundings are moving, spinning, or swaying. It can lead to nausea and disability. Vertigo is most common in elderly people, but it can affect both sexes at any age. It may be a temporary or permanent condition. Causes of vertigo. The organ of balance is the vestibular system in the ear, a tiny grid of fluid-filled tubes and sacs. There are two identical vestibular systems, located in the labyrinth of each inner ear. As you move, the liquid in the tubes also moves about, and its levels are read by nerve cells. The information is sent to the brain, which uses it to calculate which way is down and what should be the horizontal levels. Any problems with balance originate in the vestibular system, so people who suffer from frequent vertigo are said to have a vestibular disorder. Balance problems may be associated with a ringing in the ears or loss of hearing. Vertigo can also be caused by changes in the parts of the brain, cerebellum and brainstem, that are also involved in controlling balance. Major causes of vertigo include the following. Benign paroxysmal positional vertigo. This is a common form of vertigo, usually brought on by specific head positions or movements. It is caused by calcium deposits in the ear canal that periodically become dislodged and cause symptoms. Head trauma. People who have received a violent blow on the head can suffer temporary or permanent damage to the inner ear, causing balance problems. Labyrinthitis. Untreated bacterial infections of the middle ear can get into the inner ear and damage the labyrinth, and also cause hearing loss. Neuronitis. Viral neuronitis is really just viral labyrinthitis that affects the nerves of the vestibular system and not the cochlea, the organ for hearing. However, neuronitis can also be caused by a blood clot lodged in the tiny blood vessels that feed the inner ear. Meniere's disease. This was once called watchmaker's disease because it tends to strike people who do precise, intricate work that requires concentration and careful control of the hands for long periods. Nobody knows what causes Meniere's disease. Some antibiotics can damage the vestibular system in high doses or with prolonged use. Acetylsalicylic acid, ASA, caffeine, alcohol, nicotine, sedatives, tranquilizers, and several illegal drugs can cause temporary dizziness but do no permanent damage to the balance organs once they are stopped. Taken from Vertigo, Causes, Symptoms, Treatment, Diagnosis, Conditions, Med. Broadcast. Hope this answers your query.